Repeat of a statement made in the House of Commons today, Lord Markham.
Madam Deputy Speaker, with permission, I would like to make a statement on the Primary Care Recovery Plan. For most of us, general practice is our front door to the NHS. In the last 6 months, over half the UK population has used GP services, and GPs in England carry out around 1 million appointments every single day. They are doing more than ever. General practice is delivering 10% more appointments a month than before the pandemic. The equivalent of the average GP surgery sees an additional 20 patients every working day. There are more staff than ever, with numbers up a quarter since 2019, and we are on track to deliver our manifesto target with an additional 25,000 staff already recruited into primary care. And we are investing more than ever too, with the most recent figures showing that funding was around a fifth higher than 5 years before, even once inflation is taken into account. But we know there is a great deal still to do. COVID-19 presented many challenges across the health service, leaving us with large numbers of people on NHS waiting lists which need to be tackled. In general practice, patient contacts with GPs have increased between 20% and 40% since the pandemic. As well as recovering from the pandemic, we face longer-term challenges too. Since 2010, the number of people aged 70 and above has increased by a third, and this group attends 5 times more GP appointments than young people. Not only that, advances in technology and treatments mean that people understandably expect more from primary care systems. So, Madam Deputy Speaker, today I can announce our primary care recovery plan, and I pay tribute to my honourable friend, the member for Harborough, on this plan. And I have deposited copies of the plan in the libraries of both houses. Our plan will enable us to better recover from the pandemic, to cut NHS waiting lists, and to make the most of the opportunities ahead by focusing on 3 key areas. First, tackling the ATM rush by giving GPs new digital tools. Second, freeing up GP appointments by funding pharmacists to do more with a pharmacy-first approach. And third, providing more GP staff and more appointments. NHS England and my department have committed to make over 1.2 billion of funding available to support the plan, in addition to the significant real-term increases in spending on general practice in recent years. Taken together, our plan will make it easier for people to get the help that they need. Madam Deputy Speaker, the plan builds on lots of other important work. Last year, we launched the elective recovery plan, which is making big strides to reduce the backlog brought by COVID-19. We eliminated nearly all wait lists over 2 years by last July, and now 18-month wait lists have decreased by over 90% since their peak in September 2021. By contrast, Madam Deputy Speaker, in the NHS and Labour-run Wales, people are twice as likely to be waiting for treatment than in England. They still have over 41,000 people waiting over 2 years and nearly 80,000 waiting over 18 months. In addition, this January I came before the House to launch our urgent and emergency care plan, focused on how to better manage pressures in emergency departments with funding to support discharge to improve patient flow within hospitals. And so today's plan is the next important piece of work. Madam Deputy Speaker, turning to the detail of the plan, our first aim is to tackle the 8 a.m. rush. We will do this by providing GPs with new and better technology, moving us from an analogue approach to ways of working in the digital age. An average-sized GP practice will get 100 calls in the first hour of a Monday morning, but no team of receptionists, no matter how hard-working, can handle such demand. About half of GPs are still on old analogue phones, meaning that when things get busy, people get engaged tones. So we're changing this by investing in modern phone systems for all GPs, including features such as callback options, and by improving the digital front door for even more patients. In those GPs that have already adopted these systems, there have been a 30% improvement in patient feedback on their ability to access the appointments that they need. This also reflects the fact that online requests can help find the right person within the practice, such as being directed to a pharmacist for a medicine prescription review or physio for back pain. In doing so, we will make the most of the 25,000 more staff we now have in primary care. Today's plans fund practices without this technology to adopt it, whilst also providing them with staff cover to help them manage a smooth transition into this technology. Indeed, many small GP practices find it hardest to fund new technology or to manage the disruption that comes with transitioning to new ways of working. So we are funding locum cover alongside the tech itself. Notwithstanding, Madam Deputy Speaker, people will always be able to walk in or ring in if they prefer, and if someone wants to ring up and see someone face to face, these investments make that easier too. We also want to make sure that patients know how their request is going to be handled on the same day that they make contact. Clinically urgent issues will be assessed on the same day or the next day if raised in the afternoon. And if not urgent, an appointment will be scheduled within 2 weeks. But crucially, Madam Deputy Speaker, people won't be asked to call back tomorrow. Instead, they will get their appointments booked in the same day or be signposted to other services. Turning to the second area of this plan, and Pharmacy First. As well as giving GPs new technology, I know we need to take the pressure off from GPs where possible by making better use of skills of all clinicians working in primary care. We saw the incredible role pharmacists played during the pandemic, their capacity to innovate and deliver for their communities that they served, and to free up GP appointments in doing so. And so, the second part of our plan is to introduce a new NHS service, Pharmacy First, on which we are already consulting with the Pharmaceutical Services Negotiating Committee. 80% of people live within a 20-minute walk of a pharmacy, so making it easier for pharmacists to take referrals can have a huge impact. Referrals might be from GPs, NHS 111, or from next week from urgent and emergency care settings. Community pharmacists already take referrals for a range of minor conditions such as diarrhoea, vomiting and conjunctivitis. But with our Pharmacy First approach, we can go further still. We will invest up to £645 million over the next 2 years so pharmacists can supply prescription-only medicines for common conditions like ear pain, UTIs and sore throats without requiring a prescription from a GP. One of the most significant shifts we're making is in oral contraception. Pharmacists can already manage the supply of contraception prescribed elsewhere, and from later this year they will also be able to start women on a course of oral contraception. This is another way in which we aim to reduce the barriers to women accessing contraception in light of our women's health strategy. Pharmacists will also be able to do more blood pressure checks, which is one of the most important risk factors for cardiovascular disease. Not only will these kind of steps make it easier for people to get the care they need, we expect it will release up to 10 million appointments a year by 2024-25. Madam Deputy Speaker, the third part of our plan is about providing more staff and more appointments. We're making huge investments in our primary care workforce and are on track to meet the manifesto commitment of having 26,000 more primary care staff by next March, meaning we have more pharmacists, physios and paramedics delivering appointments in primary care than ever before. In 2021, we hit our target of 4,000 people accepting GP training places, and our upcoming NHS workforce plan will set out how we'll further expand GP training. We're also helping to retain senior GPs by reforming pension rules and lifting 9,000 GPs out of annual tax changes. These are the pension reforms that the BMA welcomed, describing them as significant and decisive changes and citing them as transformative for the NHS. As well as freeing up more staff time, our plan cuts bureaucracy so GPs spend less time on paperwork and more time on caring for patients by removing unnecessary targets, improving communication between GPs and hospitals, and reducing the amount of non-GP work GPs are asked to do. For example, patients are often discharged from hospital without fit notes, meaning that they have to go to their GP to get one. By the end of this year, NHS secondary care services will understand those patients' care conditions better, will be able to issue fit notes. And we've streamlined a number of targets on primary care from 36 down to just 5. Taken together, this work will free up around £37,000 per practice. So, Madam Deputy Speaker, today's primary care recovery plan funds and empowers our GPs and pharmacists to do more so we can prevent ill health, keep cutting NHS waiting lists, and improve that vital front door to the NHS for many millions of people. I commend the statement to the House.
My Lords, I thank the Noble Lord the Minister for reading out the statement. No one can be in any doubt that patient access to primary care needs a great deal of recovering from the dire situation that patients across the country find themselves in today. Millions of patients wait more than a month to see a GP if they can get an appointment at all. 65% of the public think that access to GP services is getting worse, and over 40% report that they have to wait too long to see a GP. The 9 a.m. rush and scramble to get an appointment or even a response is the reality for thousands of patients each day. Often they're waiting in pain and discomfort, unable to go about their daily normal lives. And while they wait, an illness goes undiagnosed, untreated, potentially getting ever more serious. In today's statement, the government once again recognises the major role community pharmacists can play in relieving this pressure on GP appointments and primary care. As we've made clear, we fully support and welcome this extended role, including allowing pharmacists to provide prescriptions, routine health checks, and open up more referral routes to NHS specialists, such as physios for back pain. However, only yesterday we were hearing on the national media about the 670 community pharmacies that have closed, that the number of pharmacies across England are now the lowest since 2015, and the impact rising costs, major staff shortages, and the 30% cut in government funding to date have caused, all despite growing demand for services. The industry estimate is of a 1.1 billion funding shortfall each year, and that last year has been the worst year ever. Does the Minister acknowledge that for many, today's plan is too little, too late when it comes to fixing the crisis in primary care? On GPs, the independent think tank, the Health Foundation, sums up the government's overall plan when it says that it falls well short of addressing the fundamental issues facing general practice. And of course, the key reason demand for GP services is so high is the sheer numbers of people on NHS waiting lists. The president of the Royal College of GPs said recently, patients are developing cancers and enduring so much pain they can't climb the stairs. Does the government acknowledge that unless they urgently get a grip on waiting lists, the crisis in general practice will only deepen? My Lords, more phone lines and better mood music are not going to fix the fundamental issue, the shortage of GPs. Their numbers have actually been cut by 2,000 since 2015, and now the government has abandoned its own target of 6,000 extra GPs by next year. Proposals to ease the current burden on hard-pressed GP reception staff with 240 million technology investment in phone and call systems over the next years are welcome. But does the Minister really think this is a proportional or urgent enough response to the scale of the crisis? Is the funding for the new Care Navigator staff included in this funding? What role will these new staff play in GP surgeries? When will we have a detailed breakdown of how the overall funding will be spent and when it will actually be allocated and delivered? My Lords, even the government's own benches in this House have accused it of being in total denial about the crisis facing community pharmacies. Much now needs to be discussed between the PSNC, the Department of Health and the NHS England on the promised funding in the recovery plan and to try to address the crisis. And I hope the Minister will keep us up to date as possible. Can he provide more detail on how it's envisaged the proposed new services in respect of the 7 common conditions and oral contraception will operate and interface with GP and other primary care services? Finally, my Lords, we come back to the question of the all-important workforce plan. What else? We heard in questions today from the Minister that he now thinks that spring runs on till up to the end of June. On the radio today, the Commons Minister promised us we would have it in a couple of months. Like every other health and social care service and profession we speak about in this House, workforce is core. In pharmacy, locum costs have increased by 80% in the past year alone. So, simple questions to end up with. Why is the promised fully costed workforce plan taking so long, and when will it finally be published?
My Lords, I'd like to support the comments made by the Noble Baroness Wheeler on the statement. But could I say that from these benches we welcome the aspirational nature of what the government is proposing. I think we have all learned during the COVID pandemic that community pharmacists play an absolutely key role in supporting the health system. And certainly in personal terms, in terms of securing additional injections, I've been very impressed with the way in which the whole NH system has worked so well, but delivering the service of inoculation through community pharmacies. And that, of course, then implies that, I mean, one of the good things about that was that you can book a slot in the same way that you're able to book a slot with a GP. But I think for this to succeed and to free up the 30,000 GP slots that the government intends to do, then it needs to be as easy to book an appointment with a pharmacist. We then need to be very clear what it is that pharmacists will do and what it is that GPs will no longer have a statutory obligation to do, or a contractual obligation to do. I think it would help if the Minister could just explain, in terms of the workforce shortages that have been referred to, as to whether there actually is a deliverable manifesto commitment for the government to deliver the 26,000 more primary care staff by next March. And it's difficult to see how the government is going to do that unless more money is made available to do it. So I seek the Minister's confirmation that more resource is actually going to be delivered on the back of this initiative to ensure that it actually happens. Could I just ask two further things of the Minister? Were patients of different backgrounds, different genders and different geographies involved? And can he outline the patient involvement in drawing up the plan? And secondly, are there sufficient qualified staff of all professions to deliver the multidisciplinary plan? And finally, as the Noble Baroness Wheeler said a moment ago, when does the Minister expect the new plan to be up and running? Keep doing that again.
I think the comments from my noble lords and appreciate the general welcome for the tenants of the plan from all sides. And I'd like to say that rather than too little, too late, this is actually a plan that bolsters a service which is already on target for a 50 million increase in appointments from 2019, and a service which we're seeing 10% increase per month versus pre-pandemic levels. I think on anyone's reckoning, that's a pretty impressive achievement. And I think the pharmacy first plan that we talk about will free up another 10 million appointments a year in addition to that. I think also the use of digital and technology will make it easier to get appointments and make sure that those who need the most get them, and obviously ease the 8 AM frustrations that we're all too aware of. And I think in terms of trying to address the comments on the pharmacy closures that have happened, of course, this can only but help a pharmacist by increasing the income generating services available to them and increasing the footfall that will go into those pharmacies. This can only improve their income and so their overall viability. So I would hope we would see from all of this actually an increase in the number of community pharmacists. And absolutely to answer the point, we will be setting up booking systems so you can digitally book up your pharmacy appointment. And I think equally vital to that is actually the use of the NHS app and other technology such as 111 to actually navigate you through the services, so you know when you should be booking an appointment with a doctor or when you should be booking it with a pharmacy. And so I think the use of technology will be a vital element of part of all of that. I think in terms of the workforce, I absolutely acknowledge, I think as we all do, the importance of making sure we've got the right workforce in place. That's why I think we're all pleased and all supportive of the pension changes that will increase and retain the numbers of people. I'm afraid I can't give any more news on when the date will be of the workforce announcement, but I can say that, as mentioned before, there is substantial work that is going on in this place. And yes, we are committed to the 26,000 increase in staff. And this whole package, actually there's a 1.2 billion funding behind this package, of which 645 million goes into the community first, the community pharmacy first plan of all of this, because a vital part of all of this is, of course, making sure, as the Lords have said, that we have the qualified staff in place to do it. So I think we do have a good plan here, and I think it's probably best placed by actually hearing what the industry have said in this. And we've seen welcoming from across the board. The most significant investment in community pharmacy in well over a decade came out from the Pharmaceutical Servicing Negotiating Committee. The Boots CEO, really pleased our Boots pharmacy team sit at the heart of communities, offering easy access to care and expert advice. It is great news that they'll be able to use their clinical expertise more widely to help patients. So I really do see this as a transformative step forward, united with the digital technology, which will make huge differences. And so with that, I commend a plan which will make real difference to the patients and the services they receive from GPs in the community.
My Lords, let me commend most warmly this plan. It's long been said that the family doctors were the jewel in the NHS crown. But of course, there's been a total transformation in the primary care team. It's not simply family doctors, it's a much more complex team. And the frustration so many of them feel is that they work to the minimum of their ability rather than the maximum. And as I understand this is going to enable people to work to the maximum of their skills, use their training to extremely good effect. The other great difficulty is that patients want to be treated like partners. They want information, they want contact. So opening up the opportunity to use pharmacists far more is going to be extraordinarily important. But I just wondered whether my noble friend could say a little more about the contribution of the NHS app. Obviously, it'll take time for people to be really comfortable with it, but it seems to me this could really help be a transformational component in releasing and making more available family services.
I thank my noble friend for her comments and completely agree that what this plan is all about is making sure that we're using our most skilled practitioners in the most effective way. So we want to make sure that those people who really need to see a doctor, of course, get to see a doctor when they need to see them, but those other treatments that can be helped out and served by a community pharmacy, a nurse, or some other medic, such as a physio, they are seen by the right people. And absolutely fundamental to the navigation of all of that is the use of technology and the NHS app, as my noble lady, as the noble lady mentioned, the noble friend even mentioned. And what I see in terms of the app is really helping inform people, giving them their patient records so they can do their own research, understand and take ownership of their own health, which we all know, just as we've seen it in the space of banking and other areas, giving people the ownership so they can take control of their health is fundamental. And once armed with that information, helping them navigate to the point of most use. And so that's where I see fundamental change, and I think it is something that we will see such change in the way that we all address our NHS services and look after our own health, I truly believe it will be one of the most fundamental changes we will ever see in this space.
My Lords, there's much in this... my Lords, there's much in this statement that is welcome. But I know from my own time, many years ago, as a very junior minister in the Department of Health, but also more recently as Chancellor of the University of Greenwich, and the role we play in the training of pharmacists, that community pharmacists have a real challenge, and this is small independent community pharmacists, have a real challenge in terms of space and capacity to provide advice and assistance to clients in conditions of sufficient privacy. And I wonder what proposals is the government going to come forward with what funding to assist small independent, we're not now talking about Boots and the big guys and girls in this, but the small independent pharmacists. What capital assistance is going to be provided to those small community pharmacists on our high street who potentially can play such an important role to enable them to structure their premises in a way that enables them to give the information that the government is suggesting they should give, in preference GPs?
The Noble Lord makes a very good point, and it is really making sure that the independents can play a very important role, and it is where necessary making sure that the kind of whole estates planning takes that into account. So I know a lot of the work that I've been doing with Minister O'Brien, who heads up the GP space, but I look after the capital space, is looking at how we can kind of create those sort of models where you can kind of put the pharmacies alongside the GP surgeries in many cases, and make sure that there is that capability there. I will freely admit that capital is at a premium within the system, so we have to be creative in the ways that we can do that. But the Noble Lord is absolutely correct in that this is a key way to making sure that we have those network of independent pharmacies that really can serve their local community.
My Lords, I'd like to thank the Minister for the statement, and also to put on record my gratitude to him and other junior ministers who played a very, very important part in making sure this initiative has been brought to fruition. Can I also pay tribute to the local surgery in my own community in Norfolk, the Great Massingham and Docking Surgery, where the receptionists are invariably incredibly patient and polite to everyone, and the doctors there are quite outstanding. And they really do have a lot of very, very satisfied people in the community because of their attitude to local people who may have ailments. But obviously they are under pressure, and that's why I welcome what the government said about, first of all, pharmacy first, but also what he said about recruiting new GPs. Can you tell the House, is the government's commitment to recruit an extra 6,000 GPs by the end of his parliament, is that on course? And has the number of GPs in training increased? Could you just clarify those 2 points? Non-pharmacists, as the Noble Lord Boateng pointed out a moment ago, so often they are absolutely at the centre of communities. And apart from anything else, pharmacists very often have a really strong relationship with patients because they will see them on a regular basis and will understand their needs, and they will see them consistently, which unfortunately isn't always the case with doctors. And so that's why I support the Pharmacy First initiative, which really could be almost a lifeline to a lot of pharmacies that are under pressure. Can you just tell the House, they will be able to prescribe many more medicines. Will they be able to prescribe antibiotics for some of those conditions that he mentioned? And if that is the case, that I think would be a very positive extension to the services they provide.
I think my noble friend, and actually I think really as evidence in terms of the good work that the receptionists do under trying circumstances. Actually 91% of patients have said in a recent survey that their needs were met. So again, showing the good work that they do on all this. In terms of the GP target of 6,000 since by the end of Parliament, we've currently increased it by 2,000. In all honesty, I think it's a feeling that we will struggle to meet the 6,000 target. I believe that's something that Minister Sajid Javid said beforehand. But in terms of graduates, there is actually a 50% increase in the number of graduate trainees since 2014. So there's currently over 4,000 in training. So steps in the right direction, albeit not as far as we would hope. In terms of the supply of antibiotics in the cases, so the idea behind this is that there will be certain agreed treatments that the pharmacist will be able to give. So clearly, UTIs is an example where clearly you often need antibiotics to clear those up, and so in those circumstances there will be kind of agreed treatments that they can give, and provided in the pharmacist's judgment those symptoms warrant that, then they will be able to enable the supply of those antibiotics. So I think on all those a very, very positive way forward.
Thank you. Housing policy is to build 300, or to have built 300,000 new houses a year. Has that been factored into this announcement? And is it the view of government that these new houses are a problem for primary care provision, or could the Minister assure me that the funding formulas are sufficiently robust that new housing is seen as an opportunity for primary care?
I think the Noble Lord is quite correct to point out that, of course, where you've got a number of new houses in a local community, you need to make sure that the primary care services are there to serve them as well. Funnily enough, I was having a conversation with a housing Minister McLean just today on this very subject about changing the way you look at Section 106, or as it's called, SIL payments these days, to make sure that actually the provision of primary care is one of the key elements that can be funded through that. So the primary care estate, I should make clear on that, coming out of the SIL payments. And I know it's something that the DLUC colleagues are very much on board with, because absolutely fundamental to the point the Noble Lord makes, we need to make sure that alongside the new housing, which we all agree is very important, you've got sufficient primary care services as well.
Can I thank the Minister for the statement, but regret that it concentrates on more GP services and other ancillary services to meet rising demand, rather than focusing on the causes of that rising demand. A major amount of pressure on GPs is due to the complications of diabetes, and yet inadequate actions being taken on obesity, often in the face of pressures from the food lobby. Similarly, the Minister talked about the rising number of the over 70s. I should declare an interest. And yet, much of that pressure is due to elderly people failing to get adequate social care, falling back on general practice because they've nowhere else to go. And yet, over the last 13 years, the Conservative government have absolutely run away from any sort of reform agenda for social care. So, will the Minister comment on whether new phones are going to even plug the short-term pressure, and will he tell us what sustained long-term solutions to managing down the demand for GP and other ancillary services his government is thinking of?
Well, firstly, I would completely agree with the Noble Lady's point that prevention is better than cure. And I think we would all subscribe to that. And I know the government very much in its manifesto pledge in terms of 5 years more of healthy life. That's what that's all about. How I see the outcome to that is that all comes again to people taking more control of their own health, being able to receive reminders on there that it's time for their cervical smear, it's time for their heart MOT, so that they start to see this and again take ownership of their own health and do that. And I think towards this, the community pharmacists have already provided 1 million blood pressure checks, of which 300,000 people were found to have high blood pressure. So I think that's a prime example of where this expanded network really can get onto the prevention agenda, which we all agree is absolutely key to helping solve the health situation going forward.
My Lords, I beg to move that the House do now adjourn during pleasure until 7:41.
The question is that the House do now adjourn to 7:41. Many is that, and say content? Content. The contrary not content? The contents have it.